Now you have a different kind of an office. I guess you're big on technology. Tell me about that.
Okay, so the first thing is I'm kind of like nerdy. I'm techie. I love technology. But second thing is dentistry is evolving in many, many ways. We're becoming a big part of that digital change in the world. We have now technology that we can do everything digitally. And with that, the materials have also changed. So we have stronger materials that we can design and manufacture digitally. We have ways that we can take impressions of patients without having to put anything in their mouth. It's a digital impression. So we can now have a fully digital office for most of the procedures, and the comfort of the patients is bigger. We have everything in-house, so our lab is fully digitized.
So you do everything right there?
Everything right there.
Okay.
Everything right there. So we can take digital impressions, we can fabricate digital teeth, and we can...
Wait, fabricate, so you make your own teeth right there in the office?
We do everything in the office, yeah.
Okay.
I have a full lab that does everything. Everything gets done. One of the things that I feel makes us different is that we have complete control of what we do, okay? So I live and die by what I do in there, and it better be good.
What does that mean, by the way? You have complete control. Isn't that the way it always is?
Well, no, because normally what happens is it's very fragmented. So I take an impression, if I have a normal dental office, I take an impression, I put it in a box and send it in the mail to a lab technician, and I write on a little piece of paper, please fabricate crown for Mrs. Jones, number 3. Okay, this lab technician does not know Mrs. Jones, does not know the exact color of Mrs. Jones because all I told him was this. This lab technician does not know if Mrs. Jones grinds or... Nobody puts that in the script. So we're obviating, or we're leaving behind many parts of the information that the lab technician needs. Well, since we have everything here, we spend time with the patient, with the lab technician. So my lab technician goes into every patient that I see, every patient, and he is part of the discussion. And he is part of the
Is that
team.
why you think you get better results
Yes.
than most guys?
Yes.
At least that's what you told me in the green room.
But yes.
So you have the
Yes.
luxury of just being able to do it all right there. You have your own lab.
We have everything in house, and we keep it everything. We keep it concentrated so we can deliver a better result.
Now we should mention you worked for one of the busiest implant centers in America.
Yes.
You've done more than 3,000
Implant procedures.
implant procedures
Yes.
where they walk in with no teeth and walk out with teeth.
Yes.
So in your office, you have everything you need then
We fabricate
to do this
and-
quickly.
yeah, we
Is that
do-
why you do it faster? Because it's all right there?
Well, I do it faster because I have a lot of experience behind my back. So I've done a lot of these procedures, and I don't like to say that I've seen everything, but I've seen a lot. So we know all the steps, and my team has been with me for a long time. So we all understand each other. We're a very cohesive team when it comes to doing these procedures. So my lab guys have been with me for a long time. My assistant, my surgical assistant have been with me for a long time. We are a team that has been doing this together for a long time. We understand it.
Now, since the pricing of implants and full mouth reconstruction and veneers is kind of standardized within the industry, it doesn't have to cost more to go to a prosthodontist.
No, it doesn't.
I mean,
No,
you
it
might as well
doesn't.
go to a specialist, and I'm not trying to side with you here, but you might as well go to a specialist if you're going to get like veneers done or dental implants done, over just somebody maybe that took a shorter term course. Do you believe that?
I believe that. Yes, blindly.
Okay.
I blindly believe that. But I don't want to be. Meaning, there's need for all of us.
Okay.
There's need for all of us. There's some cases that do need a specialist, and when there's a specialist is needed, you should see a specialist.